So can you state your name, title, and your area of expertise?
My name is Leila Jumalu. I'm currently an internal medicine resident first year, and my expertise is internal medicine and patient care.
So tell me a little bit in detail about power rounds and what they are.
Sure. Power Rounds is a quality improvement initiative. So it's actually an acronym. It stands for Patient-Oriented Workflow Efficiency and Results-Driven. So the concept was developed essentially during a quality improvement elective that I was participating in, and I really wanted to bring an improvement to our interdisciplinary rounds. And in essence, interdisciplinary rounds just means all the stakeholders involved in taking care of the patient, get together in one room and talk about issues related to patient care, patient safety, and discharge, whether it be social issues, whether it be reducing the rates of infections, or just addressing any physical therapy issues a patient might have. And the goal of that is, if everyone involved in the patient care is in the same room at the same time talking about the patient, there's a higher likelihood that the patient will be better taken care of and have a safe discharge.
What goes into the dynamic of a power round? I mean, how many people do you have to communicate to? How many groups or departments you have to sort of get together to have this go off without a hitch?
Mm-hmm. So it really depends on the institution, but an ideal scenario here would be when a patient comes in. Of course, there are providers taking care of the patient, doctors, there are nurses taking care of the patient. If need be, there are social workers involved, and physical therapy and rehabilitation. And since we're a teaching hospital, the providers also involve residents and medical students and the attending who leads the team. So all of those parties ideally should be involved in interdisciplinary rounds or power rounds, where they come together in one room and each team has a finite amount of time to go through patients on their list, and everyone chimes in who's involved in taking care of the patient, and we address any issues that the patient may face, and then we reach a conclusion essentially about what the next steps would be for that patient or any tasks involved for the stakeholders on the team.
With all those moving parts and pieces, what are some of the communication challenges?
Well, whenever you bring a lot of experts in a room together, there are going to be communication challenges, but I would say, starting from the providers, for example, we have to be on the same page about what the content should be in interdisciplinary rounds or power rounds. So if I'm a resident and I'm rounding with the rest of the team, I may go into detail about the administration, the dose of a medication, or the timing of the dose. But in power rounds, I need to keep the patient's diagnoses and treatment plan concise, and then talk about other issues such as ambulation for the patient, whether they'll be able to safely go home the way they came in. I'll also need to make sure that I keep the medical terms in context with regard to whoever else is in the room, so that we are speaking the same language. And of course, sometimes each department may have goals of their own, and so we have to make sure that those goals are addressed, but that we stay the course, right? Mm-hmm.
After all this information is gathered or harnessed, how do you sort of package it and get it back out to stakeholders in a report or some sort of information where it can be easily taken from a physician and read, and then they would have the information that you were trying to convey?
Right. So that's a good question. So after a meeting like this, it's definitely expected that everyone at the meeting is taking their own notes. So that's baseline expectation. But there may be someone there to serve as a secretary that would essentially write down the to-do list that we just finished talking about. And at the end of discussing one patient, if there are any communication issues, everyone should be able to say, okay, so the bottom line for this patient is we need to do X, Y, and Z. Are we on the same page with that? And everyone agrees. And then we move on to the next patient. So you don't really you don't leave the meeting feeling lost or confused about what the next steps are. And then after the meeting, you have a brief synopsis emailed out to everyone about the next meeting, of course, and the to-do list that we just finished talking about.
How do you put measurements in place so you can sort of see from 1 month or 1 week, to the next if you're making progress?
That's a good question. So measurements, so you can approach it in different ways. So when it comes to measurements, we can talk about outcome measurements, we can talk about performance metrics, and those are two different ways, and I'm sure there are others, but those are two different ways to really define whether you are having success or not in your meeting. So when it comes to outcome measurements, one of the things I mentioned earlier was about making sure we reduce the rate of infection or catheter-associated infections or Foley-associated infections. So some interdisciplinary meetings may involve nursing to report those measurements, but I think the concept behind power rounds, the way I see it, would be more about performance measurements. So we want to make sure that if there are 4 medical teams or 5 teams in general that are going to come in, present a patient, that all 5 teams actually were present, they came on time, and we were able to talk about the patients that we need to discuss. Depending on the census, if I have 22 patients on my census, it doesn't make much sense, really relating back to the workflow efficiency, to run the list for 22 patients. We may talk about patients who have been here for 5 days or more. Those may be deemed difficult discharge patients, so we really want to drill down and talk about what the barriers are for that discharge. And then there's also hospital readmission. The hope is that if we think about discharge at the day of admission, then we are thinking ahead. And so we're not waiting for 5 hours before the patient needs to leave to talk about how they're going to ambulate. We need to give time to other stakeholders to do their job so that they can communicate back to us. So those are some of the measures you can think about.
And last question, how will you evaluate the whole program as a success? What things need to be put in place for you to see at the end game being something that you could be proud of, and you could say, okay, this can be implemented. If I go to another organization, this can be implemented anywhere I go.
Right. So for me, the most important aspect would be to really get feedback from the stakeholders. This is where we were before Power Rounds were fully implemented, and here we are after, let's say, 3 months of Power Rounds going on, every week. And so to hear back from members of the different departments that, hey, I actually feel like I was able to really communicate the needs of the patient, the social issues that we had, etc., and everyone listened to me, and we came to a conclusion, or at least a partial solution. The other metric for me that would be important is, given that we are a teaching hospital and I'm a resident here, it's really important to me to see that my co-residents understand the importance of interdisciplinary rounds. It's not just a place where you have another meeting that takes up your time away from patient care. This actually is patient care in a different way. And with you presenting and listening to the other stakeholders, you do learn your leadership skills. If the attending is present, which is really a key component of interdisciplinary rounds, then you can get feedback from your attending to see, hey, did I communicate the patient's needs adequately? Is this the right way to interject during a meeting? Is this the right way to resolve a conflict that I see happening in front of me? So those are important metrics as well.
Thank you.
Sure, thank you.